Well, hello viewers, welcome to News and Trends. You are watching the Daily News Bulletin with me, KV Nurmi. In the next 10 minutes, we will try to bring you all the latest news and updates on coronavirus pandemic from across the world, the country, the region, and from the state as well. So stay tuned. But first, let's take a look at the headlines. DA hike for central government employees, pensioners put on hold till July 2021. President grants assent to ordinance for safety of COVID warriors against violence. And a total number of 20,471 confirmed cases of COVID-19 have been reported in the country so far. 652 patients have died. Now the details. The government has put on hold increase in dearness allowance for its employees because of the strain on its finances due to COVID-19. In view of the crisis arising out of COVID-19, it has been decided that the additional installment of dearness allowance to employees and dearness relief to pensioners due from 1st of January 2020 shall not be paid. The additional installments of dearness allowance and dearness relief due from 1st July 2020 and 1st January 2021 shall also not be paid. However, dearness allowance and dearness relief at current rates will continue to be paid. As and when decision to release future installments due from 1st July 2021 is taken by the government, the rates of DA and DR as effective from 1st January 2020, 1st July 2020 and 1st January 2021 will be restored respectively. President Kovind has given his assent to the ordinance that was approved by the cabinet making acts of violence against the healthcare workers as cognizable and non-bailable offences. The Union Cabinet approved promulgation of ordinance to amend the Epidemic Diseases Act 1897 in the light of COVID-19 pandemic situation, making acts of violence against the healthcare workers as cognizable and non-bailable offences. President Kovind has given his assent to the ordinance. Under it, there is a provision to provide compensation for injury to healthcare service personnel or for causing damage or loss to the property. Briefing media in New Delhi after the cabinet meeting, Minister for Information and Broadcasting Prakash Javadekar said that the healthcare workers who are trying to save the country from this COVID-19 pandemic are unfortunately facing attacks. Javadekar said no incident of violence or harassment against them will be tolerated. He said the investigation into the cases of attack of healthcare workers will be completed within 30 days and judgment will be pronounced within 1 year. Minister Javadekar said the accused of the attack can attract a punishment ranging from 3 months to 5 years and a fine from 50,000 rupees to 2 lakh rupees. He said in case of grievous injuries, the accused can be sentenced from 6 months to 7 years and they can also be penalized from 1 lakh to 5 lakh rupees. Javadekar said if damage is done to the vehicles or clinics of healthcare workers, then a compensation amounting to twice the market value of the damaged property will be taken from the accused. He also said that in the last 3 months, the government has taken several steps in the wake of COVID-19 pandemic. He said the government took the decision of providing 50 lakh rupees insurance cover each for all healthcare workers including doctors, nurses and ASHA workers. He also said under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the beneficiary will get the treatment in COVID hospital free of cost in case of coronavirus infection, and in case of non-COVID diseases, the beneficiary will also be eligible to get the treatment in non-impaneled hospitals free of cost through the certificate issued by the government hospital. Most countries are still in the early stages of dealing with the new novel coronavirus, the World Health Organization said Wednesday, while the global case count crossed 2.5 million, adding that most people on the planet remain susceptible to COVID-19. Make no mistake, we will have a long way to go. This virus will be with us for a long time and can easily ignite, WHO Director General Tedros Adhanom Ghebreyesus told a virtual press conference. Tedros called on tech companies to help reach people with phone text messages on COVID-19, starting with Asia Pacific.
Most countries are still in the early stages of their epidemics, and some that were affected early in the pandemic are now starting to see a resurgence in cases. Make no mistake, we have a long way to go. This virus will be with us for a long time. There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission in many countries.
A total of 20,471 confirmed cases of COVID-19 have been reported in the country so far. Out of them, 3,959 patients have been cured and were discharged from the hospitals, while 652 patients have died. The recovery rate of COVID-19 patients in the country has improved to 19.36%. During the last 24 hours, 41 deaths have been reported, taking the nationwide total to 681. Health Ministry said Indian Council of Medical Research ICMR has forwarded a protocol for using rapid antibody tests to all states. It is reiterated that antibody rapid tests are largely to be used as a tool for surveillance. The ministry said utility of this test is evolving globally and it is currently being used for detecting the formation of antibodies in individuals. These tests are also dependent on field conditions. As noted by ICMR, these tests cannot replace the RT-PCR test to diagnose COVID-19 cases. ICMR has assured assistance to collect data from various states to assess the scope and extent of utility of these rapid antibody tests in field conditions, and ICMR shall keep advising the states on a regular basis. The ministry said states have also been advised to follow the prescribed protocol for these tests and use it for the purposes for which they are meant. Let's bring you some of the news that's coming in from the rest of the districts. Chief Secretary Nagaland Temjintoy has informed that the state government is making every possible effort to extend assistance to daily wage earners and migrant workers. In a tweet, Temjintoy said a total number of 1,24,040 laborers and migrant workers have been helped till date. He also informed that a total of Rs 8 crores have been extended as relief by NSDMA. Please contact the district administration if anyone is in distress, Toy tweeted. Nagaland government has announced an ex gratia of Rs 10 lakhs to working journalists who suffered fatality due to COVID-19 while performing duties. The Home Department has asked the commander of 15 Border Road Task Force CO99 APO for resumption of construction of the following roads in the state of Nagaland. These roads are Koima Pedi Peran, Botsa Zizo Ni Ralan Bogajan, Twengsang Mon, Mon Longwa, Zinebuto Agnato and Kifri. An official order stated that the Border Road Task Force may commence its construction activities in the state of Nagaland as given above, and while carrying out the work, the laborers already at the site should be engaged and no new laborers should be brought from outside. Social, physical distancing and all other protocol in connection with COVID-19 should also be strictly maintained with all the necessary health safety measures, the order added. In the interest of public service in view of the COVID-19 pandemic and to maintain the various austerity measures in the state for savings in all departments, the government of Nagaland has banned all fresh appointments, including vacancies arising against sanctioned posts in all government departments until further orders. This will not apply to medical staff, doctors, nurses, technicians, paramedics of Health and Family Welfare Department who have been given a special dispensation. The instructions is issued in pursuance of the Cabinet's decision conveyed by Office Memoranda dated 21st April 2020. News from across the world, and nearly 180,000 people in the world have died from the novel coronavirus, nearly two-thirds of them in Europe, since it first emerged in China last December, according to an AFP tally based on official sources. In total, 1,80,289 deaths have been recorded worldwide for 25,96,383 infections, according to the tally. There were 1,12,848 deaths in Europe for 12,63,802 cases on the hardest hit continent. The United States is the country with the most deaths at 45,153, ahead of Italy with 25,085, Spain 21,717, France 21,340, and Britain with 18,100. Let's now take you to the daily briefing being made by the state government on the status of COVID-19 in the state.
As of 3 p.m. today, a total of 607 samples have been sent for testing from the state. Result of 543 samples have been received and all are negative. 64 samples are sent today and results are awaited. Today, a total of 1,423 persons have been screened. A total of 106 persons are under facility quarantine. With regards to surveillance activities in the containment zone in Dimapur in connection with a COVID-19 positive person of Dimapur detected in Guwahati. More than 5,164 persons have been interviewed, covering 909 households as of 23rd April 2020. So far, a total of 382 samples sent from Dimapur district in connection with a positive case have tested negative. I would like to also inform that some more activities have been allowed during the lockdown. The industries operating in rural areas outside the limits of municipal areas can operate. Research establishments dealing with agriculture and horticulture activities can function. Shops of educational books for students, recharge facilities for prepaid mobile connection, and food processing unit, such as bread factories, meal processing plants, flour mills, dal mills, etc., located in urban areas have also been allowed to open.
Well, that's all we have for you in this edition. Do subscribe to us on the YouTube channel and also follow us on Twitter. Do stay tuned as we try to bring you lots more of these news and updates through this medium. Meanwhile, we request you all to take cognizance of all the directives issued by the government in order to contain the COVID-19 pandemic. Meanwhile, stay home and stay safe. From all of us here, it's bye for now and thanks for watching.